Hello, my name is Reetu Grewal. I'm going to talk to you today about over-the-counter pain medication treatment options for seniors. As a reminder, this is brought to you by the Aging and Integrative Pain Assessment and Management Initiative, and this is sponsored by Florida Blue, and funding is provided by Florida Blue and the Florida Medical Malpractice Joint Underwriting Association. A little information about myself. My name is Reetu Grewal. I've been with the Department of Community Health and Family Medicine at UFHealth for the past 13 years, and I have no financial disclosures. So this talk is going to review the use of common over-the-counter pain medications used to treat pain. These are things that are readily found in most pharmacies. And as a reminder, this talk is to be used for general informational purposes and not a substitute for medical advice. If you do have questions about your health or the use of over-the-counter pain medications, I encourage you to speak with your primary care provider. There are other PAMI presentations available for other complementary treatments on pain. I know that in the past few years, there have been numerous products derived from marijuana, and these include things like hemp creams and CBD oils. But because there's not a lot of scientific evidence about these products and their usage and effectiveness, I won't be covering these products today. So again, if you do have questions about whether or not that might be a good choice for you, please speak to your primary care provider. So as an introduction, we know that about 50% or more of patients who are over the age of 65 report having bothersome pain in the past month. And chronic pain, which is defined as having pain for at least 3 months, occurs in anywhere from 15 to 70% of the elderly population worldwide, depending on the study that you look at. So this is a very common issue. And why is pain so common in the senior population? We know that there's arthritis pain, nerve pain from issues like diabetes, pain due to poor circulation, and pain due to cancer and its treatments. And we also know that over-the-counter medications are readily available. They're easy to use, easy to obtain, and no doctor visit is needed. So we're going to start with acetaminophen, or commonly known as Tylenol. That's the brand name. Comes in several different strengths, 325 milligrams, 500, and 650. And this is recommended by the American Geriatric Society as the first line of treatment for initial and ongoing pain management. So it is kind of won the seal of approval, if you will, from the American Geriatric Society. And so you can take up to 3 grams of acetaminophen per day. And so that roughly translates to about 1 regular strength Tylenol, which is about 500 milligrams, taken up to 6 times per day. That's considered safe. But acetaminophen can elevate your liver function tests and increase the effect of Coumadin. So you do have to be careful if you do have liver disease or you're taking Coumadin, and you may need to decrease the amount that you're taking. You also have to use caution if you do go above that 3 grams per day limit, or if you're drinking more than 3 alcoholic drinks per day, again, as that can affect your liver. You also have to be careful while taking over-the-counter cold medications or prescription pain medications, because many of them also contain acetaminophen too. So you want to look on the ingredient list for APAP, which is another way of writing for acetaminophen, or acetaminophen as ingredients on other lists. And we know that over 600 over-the-counter medications and prescription medications have acetaminophen in them. So here are some examples of some multi-symptom cold medicine that you can easily find over the counter. And you can see that acetaminophen is listed for both of these for treatment of aches and body aches and fever. So even though you may not need it for that specifically, it is in there. And so you have to be careful if you're taking Tylenol for other reasons to not get too much. And so when you look at an over-the-counter medication, you can turn it over and look at the drug facts or active ingredient list to see what else might be in there. And if acetaminophen is in there, it'll show up. On a prescription label, when you're reading that, you want to pay attention to the ingredients and the labeling. So in the red, you can see that there is acetaminophen there, and it specifically says this product has acetaminophen, so don't take with other meds that have acetaminophen in it. And then this is a great website, knowyourdose.org, with more information about how much acetaminophen you should take, which common drugs contain acetaminophen, and they also have some games on there to test your knowledge about acetaminophen. So it's a great website to check out. And now we're going to switch gears to another common class of medication called NSAIDs, or non-steroidal anti-inflammatory drugs. So I know that's a mouthful. And what does that mean, right? So non-steroidal means it is not a steroid, but they do have anti-inflammatory properties similar to steroids like prednisone. So these are great for acute inflammatory conditions like a sprained ankle or a flare-up of arthritis pain. And there are many prescription NSAIDs available as well, but this talk is going to focus on over-the-counter medications. So common over-the-counter brands include things like ibuprofen, which brand names are Advil or Motrin, and that typically comes in a 200 milligram dose. Naproxen, which is also known as Aleve, and that comes as a 220 milligram dose over the counter. And aspirin, which has different brands, including Bayer, Bufferin, and St. Joseph. And these come from 81 milligrams all the way up to 650 milligrams. There are other medications that do have NSAIDs in them, including things like Excedrin and goodies, and again, cough and cold congestion medications as well. And just be mindful because Excedrin and goodies also have acetaminophen in them, some of their preparations. And then there are some prescription medications. These include things like Celebrex, Mobic, Vicoprofen, but a lot of prescription pain medications are NSAIDs. And so you should ask your doctor before you take an over-the-counter medicine if you're also prescribed something prescription for your pain. So side effects from taking NSAIDs include these three. So it's NSAIDs act as blood thinners, which means you can have easy bruising or bleeding. And you definitely have to be careful if you're also on a prescription blood thinner. So something like Plavix or Coumadin, because your blood can get very thin. It can cause stomach irritation. So best if you take these medications with food to prevent an upset stomach. Long-term use in particular tends to cause gastrointestinal bleeding. So this includes the stomach, the small intestine, colon, and can lead to ulcerations in these areas. And these are just some maximum doses. On ibuprofen, the maximum is 1,200 milligrams per day. For naproxen, it is 660 milligrams per day. And for aspirin, the max dose is 3,000 milligrams per day. Other effects, so when taken long-term, NSAIDs can lead to worsening in high blood pressure. And even in patients who don't have high blood pressure, if they take an NSAID on a regular basis, their numbers can go up by at least 5 points. It can also worsen heart failure and lead to heart failure. And so if you have congestive heart failure and you take an NSAID, you actually can get more episodes of swelling and things, which is a problem. It can also lead to worsening kidney function when taken on a regular basis. So again, the takeaway points for NSAIDs are they're best if used on a very short-term basis, like a week or less, taking the lowest dose possible to help your pain, and also just letting your healthcare provider know that you are taking them. And if you end up taking an NSAID for more than a week, you definitely want to let your healthcare provider know so that they can monitor for any side effects. Now we're going to switch gears to topical pain medications. So these are medications that are applied to the skin. They include things that are gels, creams, and patches. Typically, you have to apply multiple times throughout the day. And you want to use on dry and clean skin. So you definitely want to avoid any areas if there are cuts or wounds, any infections or rashes. You don't want to apply these kinds of medications there. You also don't want to mix or apply multiple topical medications together on the same area. You want to do one at a time and, make sure that the previous product is removed before you start a new medication there. And then you also don't want to follow it by using hot or cold packs to the same area at the same time as when you're doing an application, as that will affect the absorption of the medication. And of course, if you accidentally ingest a topical pain medicine, either by mouth or get it in your eyes, you want to definitely call poison control. So the advantages of a topical pain medication are that the medication is localized to the area where you're having the pain. So it gets the medicine right where it needs to be and nowhere else. And it helps to minimize side effects because you're not taking it by mouth and going all over your system. But there are some side effects from topical pain medications, and these include things like rashes or redness, itching and tingling at the site of application. One of the common over-the-counter topical meds is diclofenac. This was a prescription medication until about a year ago, so it's commonly known as Voltaren, but it is now over-the-counter. And it is a gel as a 1%. It is a type of NSAID, so and it also does come in a prescription form by pill as well. So diclofenac needs to be measured out. It comes with a little card and you run the gel on it for either 2 grams for any upper body area, and for lower body like the knees or the feet, you can do up to 4 grams, and it's applied up to 4 times a day. There are other medications as well that are topical for pain. These include lidocaine, and they come in brands like Salonpas, Icy Hot, or Aspercreme. This works as a local anesthetic. So just like when you get your mouth numbed at the dentist, it's the same class of medication. And so it works by numbing the skin by blocking pain signals at the nerve endings in the skin. And this is really good for things like stings and burns. It can help take that pain away. Over the counter, it's available as a gel, cream, or spray. It is available also prescription strength, which is a 5% strength, and most of the over-the-counter strengths are anywhere from 2 to 4%, so pretty similar. And then there are classes of medication called the Rubefacients. These are also topical medications, and these include things like methyl salicylate and trolamine salicylate. So Rubefacients are salicylate-containing medications. So these are like cousins of aspirin. They also have lots of different brands like Salonpas, Bengay, Flexol, Icy Hot, Aspercreme, and there are often multiple drugs or different topical agents in the mixes, including these. And they work by a process called counter irritation. Some of the side effects from Rubefacients include burning or a cold sensation at the application site. And you definitely want to be careful because these are cousins of aspirin. If you have a history of an allergy to aspirin, you want to avoid these medications. Menthol is another common agent that's a topical pain medication. It's derived from peppermint and helps to relieve minor aches from sore muscles. Biofreeze is a common one that we see over the counter, and it again is a component of many other over the counter preparations as well. Capsaicin is another topical pain medication. It's derived from the capsaicin pepper and very good for nerve type of pain. So the pain that are kind of burning, stinging, tingling. We use it a lot for our patients who have diabetic neuropathy. And side effects include a burning sensation when you apply it, which can be overcome by slowly applying a small amount to the area and increasing it with time. And there is actually now a prescription capsaicin patch available for severe neuropathic pain. And then there's a common herbal topical medication as well called Arnica or Arnica cream. So Arnica montanus is a plant in the sunflower family, and it is the most commonly utilized phytochemical or plant-based chemical for pain relief. And it does have some positive data to support use in arthritis pain. The active ingredient in this flower is sequestrine lactones, and these have anti-inflammatory properties. And there was a really large Canadian study evaluating the arthritis that showed pretty good effectiveness as compared to some ibuprofen gel form or Voltaren, and it showed that this was equally effective. So this is a good option as well. So some frequently asked questions that I get as a physician are, can I take acetaminophen with an NSAID? So that's a medicine like ibuprofen or Aleve. And the short answer is yes. It is okay generally to take both as they work through different mechanisms, but I would recommend that you stick to the dosing instructions on the package. And definitely, if you're planning to take more than one pain medication, even if they're over the counter, that you discuss it with your healthcare provider, what you're taking, to make sure you won't have any interactions or risk of toxicity. Another common medication that we get is, can I take an oral pain medication and a topical together? So the answer for this is yes. The only exception to that rule is if you're taking an oral NSAID, so you're taking maybe ibuprofen or Aleve, and you're also using that Voltaren gel or that topical diclofenac. Because they're in the same class, you do still need to be careful with how much you take. Another commonly asked question is, should I tell my doctor if I'm regularly taking any over-the-counter pain medication? And yes, this definitely goes for pain medication as well as any over-the-counter medication. It's important for your healthcare provider to know so that they can be aware of any interactions, as well as figure out the source of your pain and possibly discuss other treatment options with you. And then, do I need to take over-the-counter pain medication with food? The answer is in general, yes, especially if the pain medicine is in the NSAID class, as these can upset your stomach. So even if you're not very hungry, you could eat a small snack like some crackers or small yogurt, and that'll help to prevent you from getting an upset stomach. And then if I do take a prescription pain medication, is it okay to take an over-the-counter pain medicine as well? And the answer is maybe. So for most patients, this is probably okay. But I like to advise patients when they're getting a prescription for pain medicine on what's okay and what's not okay to take along with their medication. So for example, if I put a patient on Celebrex, which is a prescription NSAID, I'll advise them that if their pain gets worse, they can use acetaminophen or a topical medicine, but not to use an over-the-counter NSAID like ibuprofen or Relief so that they don't get too much of that class. So it is an important question to ask your healthcare provider which over-the-counter medications are safe to take with your current prescriptions. And here's just a list of some of the references that I used to create this presentation. And at the bottom, there are some really great websites that are easy to navigate, and they can really help you with over-the-counter medications and acetaminophen awareness. And I want to thank you for listening to my presentation and encouraging you to review your medications, both prescription and over-the-counter, with your healthcare provider to make sure that your pain is being managed safely. Thank you so much. Take care.